Hello. Hi, good afternoon, everyone. My name is Dr. Gowri Kulkarni, and I head the medical operations at MediBuddy. And today we are all gathering to talk about a very, very important topic around the COVID-19 vaccines. So I'm going to wait it out for somewhat, maybe a couple of minutes because I think we started off early. So, once I have a couple of um, people joining in, then we can start it off. But just to give you a brief of what all we would be talking today, we'll be discussing about the different vaccines which are available, why are they important. We'll try to demyth some of the questions that people have regarding vaccines. We'll also talk about the second wave. Why is that there are so many cases of COVID-19 happening each single day, and the whole healthcare system is getting pressured with the number of infections and the number of people who are affected by COVID-19 infection, right? So we'll be talking about a lot of things, but primarily we'll be focusing on the facts and myths around the COVID-19 vaccines, which are currently available in India, and a few of them which are in the process of, being given a green signal by the government to be started as well. So we'll talk about a lot of that in today's session, right? So let me know when a few of you have joined in so that we can start off this discussion. Of course, please bring up your questions. Your questions help me they help me to answer, of course, understand what is it that you would want to know, but it also makes it more interactive and clarify any kind of doubts that maybe you have or people around you might be having, right? So please do ask your questions. All right. So I think I'm gonna just start off with our topic for today, right? So let's talk about the COVID-19 vaccines, which are currently going on, right? So we know that it's been, from January onwards, we had vaccinations which were rolled out initially in the first phase. We had the healthcare workers and the frontline workers who were given the vaccines. Then it was for the older people, about the age of 65. And currently it is open for anybody who is about the age of 45, right? And the available vaccines in India, we have two brands. I hope everybody knows that. By now, everyone knows it, that we have either the Covishield vaccine or the Covaxin, right? So Covishield has been developed by the Serum Institute of India and along with the Oxford AstraZeneca company, and they have brought this out. It's a mRNA-based vaccine, virus vaccine. And the other one is the Covaxin, which is our indigenous, made by Bharat Biotech. It's a killed or inactivated virus vaccine, right? So there are these two vaccines which are currently available and approved for use in India. We are also, government is trying to give approvals for another vaccine, which is coming from Russia, that's the Sputnik. And then there are talks about trials for the Johnson & Johnson vaccine, which is going to come out. It's a single dose vaccine. So, but currently for use, the vaccines which have been deployed are just two, that is your Covaxin and the Covishield. Okay, so I'm sure that if you've had older people around you, you've already got them vaccinated, or if you are about the age of 45, maybe you would have just taken it in the last couple of weeks, right? So the two vaccines which are currently available, both of them are basically intramuscular vaccinations, means that they are given on your arm. And the duration between the two doses that vaccines have been approved for are a little different. Early on, it was different, but current recommendation goes that the Covishield is highly efficacious if the second dose is given between the 6 and the 8 weeks from the first dose. And the Covaxin is, of course, between the 4 to 6 weeks, right? Now, because these two vaccines are made, they're different types or they're made in different ways, we can't mix and match these vaccines. So if I have taken my first dose as Covishield vaccine, then my second dose will also be Covishield. Versus if I've taken my first dose as Covaxin, then my second dose would also be Covaxin. So that is something which is very important. So if you're going to a place for vaccination, then you need to ask which vaccine has been given to you, right? Now, there is a question which pops up. So which is better? Is Covaxin better or Covishield better? Both are, all right? So from an efficacy perspective, any vaccine approval happens if they're efficacious more than 50%. So both of them have been shown to be efficacious more than 50%. And yes, if they are available, then my suggestion and my advice is that you should go get vaccinated currently if you're about the age of 45. All right, so that's extremely, extremely important. Now, of course, the next question comes in, and I think there's already a question which has been asked, is that, is it safe to take the medicine during pregnancy, right? Now, because there are only these two vaccines which are currently available, and because there has been not enough studies which have been done, when I say study, it means trial of the vaccine done in patients who have been pregnant or lactating, there are certain contraindications to the vaccinations as well, right? What do we mean by contraindication? That this is best not used in certain conditions. One is in children less than 18, because the trials have not yet been done in children under 18. There are still trials going on between the age of, say, 15 to 18. It is going on, so, but it has not yet been approved for use. So as of today, for children less than 18, the vaccines are contraindicated. For women who are pregnant or women who are lactating, that means they're breastfeeding, it is best to avoid taking the vaccination, because trials have not been done to see if there are any possible effects on the fetus, right? So we do not know. So currently it is best to avoid taking the vaccine if you are pregnant or if you're breastfeeding, all right? Another contraindication could be that if you've taken your first dose of vaccine and it has led to a severe form of reaction, right? Like a hypersensitivity reaction, then it is said that you should not take the second dose, okay? Also, if you are somebody who has known hypersensitivity or allergies to certain things, especially the contents of the vaccine, then maybe it's a good idea to avoid taking the vaccine, right? Another thing which has been talked about is, of course, the coagulation disorders. If some people have increased risk of clotting, then maybe you need to talk to your doctor before you go ahead and take this vaccine, because a lot of you might be on certain drugs when it comes to coagulation issues. So it's a good idea, if you are on multiple drugs, to talk to your doctor. However, this vaccine is especially given to all people, especially if they have comorbidities. What do you mean by comorbidities? It means that people who already suffer from long-term chronic diseases. Like, so if, for example, somebody has got sugar problem, diabetes, somebody's got heart-related issues, high blood pressure, that's hypertension, people who have, say, lung-related ailments like asthma or obstructive pulmonary diseases, right? People who have chronic diseases, I think it's extremely important that you take the vaccine. Why? Because your risk of getting the COVID-19 infection and the consequences of the illness itself would be extremely serious, or the complications can be serious, and hence the reason that vaccines are recommended in people who do have chronic diseases, right? Even in people those who have, say, who are immunocompromised, right? People who are on drugs which reduce your immune system or immunity levels, right? Or people who suffer from illnesses such as HIV. All of them should take the vaccine, because it only would protect you from the COVID-19 infection, which is the complications of which can be quite serious, right? So it's absolutely important that if you have any chronic diseases, please go ahead, get yourself vaccinated. If you are on certain drugs, it's always a good idea, especially drugs which are related to, any coagulation disorders or clotting issues, then it's a good idea for you to talk to your doctor, understand if you can take the vaccine or not, and then proceed ahead to taking the vaccine, all right? But it's important that you are aware of this, and please go ahead and seek for the vaccination, right? So there's a question about ideal time period and doses, right? I was just mentioning that, but I'll repeat it again, that if you're taking the Covishield vaccine, all right, the second dose is recommended to be after 6 to 8 weeks of the first dose. If you're taking Covaxin, then it is between 4 to 6 weeks of the first dose. The second dose would be 4 to 6 weeks after the first dose, right? So I hope that this is very clear between the time period of first to second dose, right? Now, why do we need 2 doses, right? The first dose is more like, how do I explain that? Like, for example, the first dose is more like a memory formation, right? So when you give a vaccine, what happens is that our immune system kind of understands that this is something new and tries to build a army against it, right? So when you give the first dose, it's more like helping our immune system to build memory against this particular illness, right? Now, when you give the second dose is when there is a proper antibody response, and the second dose builds your immune system to be able to fight this infection better. Right? Now, it is typically said that the development of immune response and the immunity towards the illness takes about 2 to 4 weeks from the second dose. So even if you have taken the first dose, right, it doesn't mean that you're protected, right? Everybody needs to understand. One of the things that I feel as a doctor that I have seen that there is this surge or the second wave, as we are calling, is because a lot of people have kind of taken a step back from their the so-called COVID appropriate behavior, because a lot of people have taken vaccines, but they are not using masks. They are not, practicing physical distancing. People are getting into crowded areas very often. And this is the reason why the infection is again spreading. Something that we had been able to control well has suddenly increased, right? So understand, just because we have taken the first dose doesn't mean that we are safe, right? Now, understand what is the purpose of taking a vaccine, right? Does it mean that when I take a vaccine, I will not get the illness? That's not always true. Yes, most of these vaccines have a good efficacy, right? They will protect you to some level, but what it basically helps us, if we do mass vaccinations, a lot of people are vaccinated, what it basically helps is it reduces our intensity of illness. So even if with the vaccination, I'm going to get the infection, my symptomatology would be much lower, which means that I will be having very mild form of illness, which I'll get better. So I may not require hospitalization. The patient may not require very higher end medications. Mortality rates would be less, right? And by vaccinating each one of us, what will happen over a period of time is we'll be protecting other people as well, right? By vaccinating ourselves, we'll be helping other people to not get the illness, right? So we need to understand that vaccination will help in reducing a lot of things like mortality, morbidity and mortality, hospital stays, our expenses, everything. But to prevent ourselves from getting the illness, we need to still follow COVID, appropriate behavior, which is still the same. Wearing a mask, proper sanitization and, washing our hands regularly, ensuring that we, have physical distancing or between people around us, and preventing crowding. All right. So this is extremely, extremely important. Of course, the most important thing is if you do have symptoms, do not ignore and reach out to a doctor. Talk to a doctor, right? A lot of people I have seen is that they tend to not open up and not talk and quickly seek help. They would wait for a couple of days before they seek help. And by that time, things have already worsened. So please seek help early, right? I hope that that the message is out very clear for everyone. Okay. Now I have a couple of questions, so I'm going to quickly try to read through them and then quickly answer, right? So there's a question about I took Covishield on Friday and today I got COVID positive. I'm so sorry. Now, there's a possibility when you say you've got COVID positive, is it that you've got symptoms? If yes, sometimes people do take the vaccine and after that they do have COVID positive status for a couple of days. But if you're symptomatic, then you should treat it as a COVID, RT-PCR positive case, and you should talk to your doctor. You may require vitamins, some symptomatic medications in terms of if you have fever or cough, things like that. There'll be certain preventive medications in the form of, say, antibiotics or immune modulators that would have to be given. And you would also have to ensure that you are constantly checking your temperatures, your oxygen levels at home, and ensuring that they are maintained. For example, your oxygen level should always be above 95. If you see a pattern where it is dropping, then you may need hospitalization. Talk to a doctor who would be able to understand all your symptoms and accordingly give you medication, because you might be, if you're, say, allergic to something, then we'll have to ensure that you're given the right type of medicines. All right, but please do talk to the doctor, right? It is possible, it could be because of the vaccine, but it's a good idea if you're symptomatic to talk to a doctor quickly. Okay, now how many days fever stays? It's very interesting. In the second wave, at least the patients that I'm seeing the patients having fevers for a longer period of time. Say last year when I was consulting for patients with COVID, I was seeing that they would have the mild to moderate illness. Patients who had mild to moderate form of illness, they would have, say, fever for about 3 to 5 days and less than 7 days, right? But now I'm seeing patients who had fever for like 10 days, 14 days, and longer period of time. So yes, it is possible that your fever stays for a long time, but ensure that you don't stay in fever. You treat it, you talk to a doctor, take the right kind of anti-fever medicines, so that your fever is brought down, okay, in the right optimal dose. Ensure that you're hydrated well, because if you're having fevers, you tend to get dehydrated. That worsens your condition. You start getting body aches, fatigue, and muscle pains. So take care of your fever well, talk to your doctor, and be in constant touch with your doctor. When your fevers are there, also understand that your oxygen saturations typically drop. So hence it's important that your fever is controlled well. Okay, keep checking your saturations, your oxygen levels with a pulse oximeter machine. Reach out to your doctor, talk to a doctor quickly on the phone so that these things can be addressed quickly. All right. There's a question which says Covaxin, Covishield, which one is good? All of them are good. They are vaccines. They have been approved. There have been sufficient clinical trials that have happened. Whichever vaccine that you're getting, please go ahead and get vaccinated if you are about the age of 45 as of today. It's being said that maybe it's going to open up very soon for everyone about the age of 18. But as of today, if you are getting the vaccine, please get yourself vaccinated. But remember that you need to still follow COVID appropriate behavior at all times. Okay. All right. So there are a couple more questions. I'm going to quickly read through them because I might miss out on a few, right? There's been a news that vaccination leads to reduced fertility in men, anti-fertility. See, I think there's a lot of misconception about the vaccines going around, and people have been talking a lot of it, right? These are all, I would say, a part of wrong propaganda that is happening, right? There is nothing like that. There are no, there has been no study which says that vaccines will cause erectile dysfunction. On the contrary, right? There has been said that people who have coagulation, because with the COVID disease itself, the COVID-19 infection, there have been certain people who have clotting issues where their blood becomes thickened. And in those people, there have been very, very rare instances where erectile dysfunction has been seen for people who have suffered from COVID-19. This is not to do with the vaccine. So please do not worry about infertility or anything to do with, not able to conceive after this, right? It's a misinformation that is going around. There's no truth behind this, right? So please go take the vaccine at the earliest if you are in the group that can take it, right? Can cancer patients take it or not? See, most cancer patients, yes, can, because they have a lowered immunity. However, certain patients who have cancers do have coagulation problems, right? And they might be on certain drugs which lead to increased clotting and can lead to, say, deep vein thrombosis or pulmonary embolism and things like that. So if you have cancer, most cancer patients can take the vaccine. However, please talk to your oncologist once, because we do not know what drugs you're on and do you have any type of cancer which leads to coagulation issues. Okay, so it depends on that. So please talk to your oncologist, but most patients with cancer can take it and it is recommended as well. Okay. that I have heard about cases where vaccine leads to blood clotting. Is it possible? Now, understand that it's the COVID disease itself which clots leads to. So if you've heard, if people who are having serious form of illnesses with, say, lung involvement and pneumonia, a lot of these patients are put on blood thinners, right? You must have talked about or heard about it, about people being on blood thinners who are having the COVID-19 infection, all right? Now, the thromboembolic phenomenon, which has been seen to be seen after the vaccination, have been very, very rare and sparse, okay? Every vaccine unfortunately comes up with side effect profile. I'm sure that if you have taken the first dose, most of you must have at least taken the first dose of vaccine, right? Because it opened up in March. So many of you might have taken, if you're above 45, then at least the first dose, or if you're about 65, many of you might have been just about around their second dose, right? So understand that most vaccines, right, and especially let us talk about COVID vaccine, they will cause you some amount of side effect, right? Those basic side effects and very simple side effects could be just the local tenderness, you feeling pain in the arm, or there is tiredness, mild fevers, fatigue, myalgia, as we say, or aches and pains, are very common, right? Some people also develop some amount of cough and cold or soreness in the throat can happen, right? But it's only the rare and very, very rare side effects where there could be some kind of a coagulation issue, or demyelinating diseases have also been seen. But these are so rare and so wide, you know, anecdotal, I would say. The amount of goodness that the vaccine is doing is definitely much, much, much higher as compared to the side effect profile. It's unfortunate, but then they are present with anything that we take, right? Any drug or anything that we take, there will be some amount of side effect. So my suggestion to you is, as a doctor, that if you are getting the vaccine, please get yourself vaccinated, right? There's a question about a person around the age of 60 having issues like heart disease and diabetes. If they take vaccine, is there any possibility of side effects? So as we said, right, they should take vaccine. By default, people who have chronic diseases, it is recommended that they take vaccines, right? Get vaccinated. And usually, like most people would have very mild or no side effects, right? The mild side effects, as we talked about, was soreness, mild fevers, aches, tiredness, injection site tenderness, and those would be the mildest form of possible side effects, right? If you've had children, right, if you've seen your children get vaccinated, right, have you seen that most of your children, when they're tiny and they're getting their initial, in the first 6 months they're getting vaccinated, most of them develop a fever, right? Most children have, say, maybe a swelling on their legs when they are getting vaccinated. This is similar to that. Okay, this is similar to that. So do not worry about the side effect profile. If you're having chronic diseases, do get yourself vaccinated. It is also important that you talk to your doctor. If you have a treating doctor, if you have a diabetologist or a cardiologist who you reach out to regularly, then I think it's a very, very good idea for you to also talk to your doctor once, right? But according to recommendations, yes, you should get vaccinated if you have chronic diseases. Okay. There's a question which says temperature is fluctuating up and down in the morning time. It's showing low temperature, and in the evening it's showing high temperature. And this person is also having some cough and unable to sleep properly or eat. I'm so sorry you're suffering so much, but how long has this been? If you're having fevers, dry cough, reduced appetite, it's important that you seek a doctor's advice, talk to a doctor. And if you have any of these symptoms, it is a good idea for you to get your RT-PCR COVID test done. All right. It's extremely important if you have this. In the meantime, keep yourself hydrated. Take a medication to reduce your fevers. A simple paracetamol can help if you're not allergic to it. But do not neglect these symptoms. Please, my earnest request to you is to go talk to a doctor on the phone, or you could visit a doctor in your locality if you have a hospital or something nearby. Okay, but please do not ignore your symptoms. Okay, these could be signs of COVID. It could be signs of anything else, but unless somebody talks to you in detail and gets your history, we may not be able to help you, right? But please do take care of yourself, right? There's a question which says, can mild infection be controlled or healed at home? Yes. Most people, okay, and this is for everyone, most people who have mild or mild to moderate illnesses get well at home if they are treated quickly early on and they're monitored well. Okay. However, if they have chronic diseases, they are older people, or they are not able to maintain their oxygen levels, or they are not able to, they are very high grade fevers, are not able to, they're getting very dehydrated, or there's some reason for which hospitalization seems to be the right approach, then that is required as well. But most people get better at home. You have to just be isolated at home, take the right medications, and you will get better, right? So, but talk to a doctor. You have to be constantly in touch with your doctor. You have to ensure that you're on the right medication, right? So just to give you a quick brief on what all you need to do if you have mild infections at home, right? So one is control fevers, okay? Two, control any other symptoms. Say, for example, you have a cough or a cold or something, right? Ensure that you take a few of your, vitamins, which your doctor would advise you to take, right? Next would be you take care of your hydration. Drink lots and lots of water. Keep yourself hydrated because fever, cough, all leads to dehydration. Ensure that you're drinking a lot of water. Fifth, ensure your nutrition, right? Eat nutritious food, eat food which are high on vitamin C, all types of vitamins, ensure that you take a good nutritious diet, okay? And six is definitely ensure that you're checking your temperatures, you're checking your oxygen levels at home. And if you see that there's a pattern where the oxygen levels are dropping below 95, rush to a hospital. All right. These are the few things that you can do at home. The most important thing is to be in touch with the doctor, every day or every other day to ensure that you have somebody who is, looking at your symptoms well. Okay. Right. Now, will CRP increase during COVID positive? Yes. The CRP is basically C-reactive protein, and it is acute phase reactant, right? It's an inflammatory response. What happens in COVID, right? There's an inflammation that is happening inside our body, okay? So usually the COVID infection would be in the upper airways, right? Your nose and your throat, but some people might have it in their chest as well. There's the pneumonia, right? And CRP is one of those things which can be increased. So yes, it's a possibility. If you have a raised CRP, you may require some amount of medications such as preventive antibiotics also, or maybe immune modulators and other medications. So you will have to talk to a doctor to take care of it, right? But it usually reduces on once the treatment has been started. All right. Somebody said, my mother is having filariasis for the last 30 years. Can she have? Yes, she can have the vaccine. Please take her to the vaccine and get them vaccinated. It's been 2 weeks since I took my Covishield. Does it protect against hospitalization even with one dose? A difficult question to answer, but good that you brought it up. See, as I was mentioning, right? First dose is a memory formation in your body, right? Second dose is when the actual immune response happens. Does it mean that even after second dose, you are completely protected from COVID? Not really, okay? You will still have to ensure that you follow all your parameters, which means your COVID appropriate behavior. So if you are, 2 weeks down now that you've taken your first Covishield, and congratulations for that. I'm so happy that you've taken the vaccine. Please ensure that you are taking care of yourself, following all the right things that you're supposed to do, and take care of yourself. It is extremely, extremely important that you do that. Does it protect you against hospitalization? I hope it does, right? But there are no specific studies here, right? But what can help you better is that you protect yourself from getting the infection in the first place, all right? And if you do get it, if you do have any symptoms, get it treated quickly, right? Start your medications quickly. I think that is very, very important. Okay. Is Covishield vaccine safe? Yes, it is safe. Please do take it. We spoke about the side effects and some of the contraindications. So if you don't fall into that contraindication profile, then please do take the vaccine, right? Somebody somebody asked, my wife has a thyroid problem and a gallstone problem. Can she take either of the vaccines? Yes. Yes, there is no reason to fear this. Please do go ahead and take vaccination. It's good. If she's on multiple drugs, thyroid should not be a problem. If she's on any other kind of drugs where there could be an issue with coagulation problems, then do talk to the doctor once. But by itself, for thyroid problems, there is no issue. Please go get yourself vaccinated. All right. There's a question which says, I have a 3-year-old. And yeah, that must be a tiny age, isn't it? And he's calling me continuously, Dad, open the door. I want to play with you. And if I allow him inside the room, does he get affected with the same? If you are a COVID positive patient, then you have to completely isolate yourself. I feel for you. I know how difficult it is with the children, right? And he's such a tiny one, and it's not very, children may not understand the gravity of the situation. But the fact remains that you will have to isolate. So unless he doesn't have anybody else to take care of him, well, then that's a different situation. But if he has anyone else who's taking care of him, in the best interest of yourself and your family and your child, you have to isolate yourself. You cannot play with him. You just cannot, right? You cannot, because you may inadvertently spread the infection, and that's not that's not what you would want to do for your child, right? So I'm really sorry, but no, he cannot come into your room if you are COVID positive. All right. When should the second dose be given? I think we've already talked about it. If it's Covishield, 6 to 8 weeks, second dose, Covaxin, 4 to 6 weeks, right? Tips for reducing cough. See, if you are a COVID positive and you have a cough, I'm sure that you're talking to a doctor, and the doctor would give you certain medications to help take care of the cough, right? But I think there are other things that we can do at home, right? Like, for example, take something which is soothing for your throat, drink something warm. These days, you get these herbal, lots of herbs, like you could have your ginger and tulsi and lots of these spices which help you in soothing your throat, right? So you could do that. The other thing very important thing that you can do is do deep breathing exercises. Why do we cough, right? That's because our airways are narrowing. So when you cough, you try to open up your airways. It's a forceful exhalation, which is basically cough, right? So it's important for you to understand that by doing deep breathing exercises, right? So what you do is take a deep breath in, try to hold the breath for say 3 to 5 counts, and do a slow breath out. If you're able to do that over a period of time, it'll help in opening up your airways better. All right. If your cough is continuous, your doctor may also want to, and if it is leading to reduction in your saturation, in your blood oxygen levels, then your doctor may want you to get hospitalized, or they may give you certain inhalers or nebulization. So it depends on the person, it depends on what your condition is, right? But at home, you could do things like, warm water, things which soothe your throat, do your deep breathing exercises, usually they help in reducing cough. All right, I hope that helps. There is a question which talks about rheumatoid arthritis. You're worried about your mother who has a lowered immunity and has rheumatoid arthritis. A lot of people who suffer from rheumatoid arthritis or other autoimmune diseases are usually on steroids. A lot of people are on steroids, right? And yes, that can make one scared as to, do I need to take the vaccine or not? Usually there is no contraindication. You can take the vaccine. There's no harm in taking a vaccine, because actually your immunity is already lower. So your risk of getting the infection is actually much more, right? So yes, you can. And especially if you're not on any steroid at this point in time, there's no harm in taking the vaccine. Please go ahead and take the vaccine. Of course, you can talk to your rheumatologist once before you do that, okay? Can a person take vaccine if he's on ecosprin? Currently, the latest guideline says, yes, you can, right? However, it depends on what dosage are you on, and is it only ecosprin, or are you on any other kind of blood thinners like, heparin or, Claxan, any of the other blood thinners. If that is there, then you have to talk to your doctor once. But per se, I think you can take the vaccine. Currently, there is no specific contraindication. All right. There's a question which talks about, I had 5 to 7% lung involvement after 14 days of home quarantine, okay? And again, tested positive. I have got admitted and got negative. how long will it take to recover fully from lung infection? I'm so sorry that, you know, you had to go through this harrowing experience, right? But I'm sure that you, so 5 to 7%. Now, let me also, you know, for the benefit of the larger audience, let us talk about something called as CT value. There's a lot of talk about this in the media as well, and I've been reading up, and people are all confused about it. So there are two things which are there. One is called as a CT value, which is your cycle threshold value, which comes as a part of your RT-PCR report, right? When you take the throat and the nasopharyngeal swab is taken from you, and you see the report, it is written, you know, okay, SARS-CoV-2 virus positive, and then there will be something called as a CT value given, right, which is a cycle threshold value. What does it mean? The higher the cycle threshold or the CT value, the milder is your illness, most probably. And the lower the CT value, the more severe form of illness is there. Okay, so that is a part of your RT-PCR report. The other type of CT value is your CT severity score, which is CT means the CT scan of the chest that is done in most patients who have lung involvement, right? So when you do a CT scan, there is a certain scoring that is given, okay? The severity of involvement of lung, okay? Now, if the scoring is usually out of 25, and if it is less than 8, it is usually seen as mild. Then from 8 to 15, it's moderate, and then above 15, it is definitely something which is very serious form of involvement of the lung, right? So if you are having, and I'm presuming when you say 5 to 7% of lung involvement, it means your CT severity score was say between 5 and 7, so which is a milder form of illness, and thank God that you were not affected in a serious form. So that's great. And but I know that in many patients, the COVID RT-PCR test can continue to remain positive even after 14 days. Okay, it can continue to be positive. But if you're asymptomatic after 14 days, then you're all right. You're not a spreader as such, right? Now, in terms of how long will it take to recover, it depends on your physical state. So, how physically fit you are. So a lot of times post the infections, we say you need to look at your nutrition, ensure you have high protein diet so that you build your energy and build your muscle strength, so that you are able to regain your energies as well. Then you will also need to do a lot of chest physiotherapy, ensure that you open up your lungs better, do a lot of exercises specifically for opening up your lungs, breathing exercises, and also you can talk to a chest physiotherapist as well if you would want to. It usually takes anywhere between 4 to 8 weeks. It depends on the severity of illness, right? But I think you should get better in about 4 weeks time. All right, so take care of yourself. Look at your nutrition, look at your chest physiotherapy, look at your breathing techniques, do your exercises properly as told by your doctor, and I'm sure you'll get better soon. All right. So is it required to test for COVID before vaccine? No, it's not required really. Okay. There's a person who has said that their mother is on an anticoagulant twice a day. Can she take a COVID vaccine? My recommendation to you is we need to know why she's on anticoagulant. And my recommendation would be you should talk to the doctor who started her, because we do not know what was the reason for being on the drug. All right. Let's go ahead, and there's so many questions. I'm sorry, I'm just taking a little time to kind of read through. Okay. If I take vaccine, is there a chance of a blood clot? As I said, we spoke about the side effect profile, and yes, one of the contraindications for vaccine can be coagulation disorders, and there's a very rare side effect of thromboembolic phenomenon. Having said that, what the COVID infection can cause can be more disastrous than what the vaccine can cause, right? And as the risk to benefit ratio of taking the vaccine is very low, which means that the benefits always is outweighing the risk of getting the blood clot. So if you ask me, you should go ahead and take the vaccine. All right. Is there any tendency of vomiting after vaccination? Could be possible. Few people do get gastrointestinal symptoms as well after vaccination. In the second wave, it's very interesting. Even with the COVID infection itself, a lot of people are presenting with COVID infection with gastrointestinal symptoms, right? We typically have always been thinking of COVID as something which is to do with the chest and infection such as cough, cold, fever, right? But a lot of people who are getting infected with COVID are also getting gastrointestinal symptoms such as acidity, dyspepsia, loose stools, vomiting, stomach pain, and all. So that is a possibility. With vaccination, also, few people do have a nausea as a side effect, but it usually settles down with. And if it's too difficult, then you could talk to a doctor and take a antiemetic or a anti-nausea medicine, and it should get better. All right. Um, what type of precaution should be taken after vaccination? I think rest it out. The most important thing is that once you're vaccinated, you've taken your first dose, rest it out. Most people do get some amount of pain and tenderness and fever and tiredness. So just ensure that you are taking rest for a day or two. Drink lots of water. If required, take anti-fever medicine. Take a paracetamol. Of course, if you're not allergic to it, only then, or talk to a doctor. But it should settle down. Usually, most symptoms get settled down between 24 to 48 hours. So if you may have to take a day's rest if that's required. And the most important thing and the precaution that you should take after vaccine is to remember that you have to still follow COVID appropriate behavior. Keep wearing your mask, ensure that you are practicing physical distancing, stay away from crowded areas, keep sanitizing your hand. This doesn't go away, all right? So ensure that you are doing this even after vaccination, all right? There's a question about having undergone, elderly father who's undergone brain surgery and for hemorrhages and has high blood pressure, is on medication, has been on blood thinners. See, if he's been on blood thinners, which is not a basic ecosprin, but like a heparin injection, then you should talk to your doctor. May not be advisable, but I think you would want to talk to your doctor who has been treating your father, because there is a possibility that there could be, increased risk of thromboembolic phenomenon. There could be possibility of a clot formation. So we do not know. But please talk to your doctor once, in my opinion. Without that consultation, I would say not to take the vaccine at this point in time, right? Great. So is there a gestation period post-COVID negative to take vaccine? Wonderful question, right? So if you have suffered recently from a COVID infection, then you need to wait for 2 weeks after your infective period before you can take the vaccine dosage. All right, you have to wait for 2 weeks. All right, so I hope that's very clear. So if you say you finished your isolation period today, then you wait for 2 more weeks and then you can go ahead and take the vaccine. All right. Can someone take 2 or more vaccination to build stronger immunity? Not recommended at this stage. All vaccines have shown to improve, reduce mortality, reduce morbidity, reduce hospital stays. All vaccines have shown to reduce the severity of illness if it does happen. So taking 2 vaccines is not going to make any difference. Please stick to only one brand. So if you're taking Covishield, take 2 doses of Covishield. If you're taking Covaxin, take 2 doses of Covaxin. That's it, right? There is a question which says, doctor gave medicine for 5 days. Shall I go ahead and for another test after 5 days? No, not really. If you're isolated, and I'm presuming you're COVID positive and you're isolated yourself, you have to isolate yourself, or please isolate yourself for 14 days and do not go ahead and do any tests in between, because you will still be most probably COVID positive. So there's no reason why you should get yourself tested within 5 days. Most doctors will give you a medication only for 5 days, because most preventive antibiotics or even modulators which are prescribed are only for 5 to 7 days usually. And if you have had a very milder form of illness, then you should get better by then. But you have to isolate yourself for 2 weeks, and that is important, right? And there's no need for you to test before that. Okay, so please do not test within 5 days. It will not help you, and most probably your COVID positive status will still be there. So, not required for you to do another test in 5 days' time. There is a question which says, my dad got his bilateral knee surgery in November. Okay. and is still recovering from that and under medication, also a diabetic, and he's 67 years old. I think there should be no issue in him taking the vaccine. But of course, if he's on multiple drugs, it's a good idea to know the drug list, of what kind of medications he's on. But I'm presuming that he must be only on, sugar lowering medicines and maybe some pain relief and some kind of vitamins. If that is the case, then yes, please go ahead and get him vaccinated. All right. If there is any doubt, always get a consultation from doctor who would also see the list of medications that he's on. Okay. Um, my father is a cancer patient, already cured from cancer. Congratulations. So your father is a cancer survivor, and can he take a COVID vaccine? Of course, yes, he can take the COVID vaccine. Please go ahead and get him vaccinated at the earliest. All right. Um, so there's a question which says that somebody got infected with COVID-19 last year in August. Would antibodies be still present in my body? Okay, that's a good question, right? Studies have, like, there has been a lot of studies on reinfection. A lot of people are getting reinfected in 3 to 4 months time, right? So if you had a past COVID-19 infection, you should still get yourself vaccinated if you are, above the age of 45 as of today. So even if you have antibodies, still it is recommended that you take your vaccine. All right. So when there's another question, when should one take the vaccine dose after the COVID treatment? As I said, 2 weeks after your isolation period. So please go ahead and take your vaccine. All right. I'm just going to read through a couple of questions. Today is day 10 of my COVID infection. I'm hoping you're feeling better. And I feel much better post the favipiravir. Good that you've taken your antivirals as well, and the doctor has prescribed you that. Should I go for vaccination? Yes, you should. 2 weeks again, right? You should. Good that you're feeling well. Once your isolation period is finished, wait for 2 more weeks, recuperate, take care of yourself, rest it out. And then after 2 weeks, you can take the vaccine. All right. Somebody's asking a question about sugar problems. Blood sugar is a little on the higher side during fasting. It's 140, and hypertensive, a little on the higher side. Will it be a concern for vaccination? Not at all. Please go ahead and get yourself vaccinated. Even if you have suffered from COVID-19 last year, please get yourself vaccinated. There are no two ways about it, right? If you're infected in the past, you have any chronic diseases, please get yourself vaccinated. There's a question which says, I have fever and some kind of cough and body pain, but no loss of taste and smell. If you have these symptoms, please consult a doctor, get your RT-PCR done. There is a very high likelihood that any fever and cough can be COVID-related symptoms. So do not neglect your symptoms, all right? There's a question about somebody who has spoken about his father. My father is 59, was COVID positive in December, but suffered from diabetic foot, underwent a surgery and on an antibiotic. So there are multiple comorbidities, right? Your father is having diabetes, thyroid issues, blood pressures, diabetic related complications of the eye and the nerves, on medications, a lot of things, right? So the doctor has said that, you have a treating physician, right? So I'm sure the physician has already checked you up and he has said that please take the vaccine. You should go ahead and take the vaccine, okay? You don't need to take opinion from everybody, right? Your physician, your family physician who has looked through all your drug list would definitely know what is to be done, okay? So don't worry about it. If the physician has given you a thumbs up, that's it. Please go ahead and get your father vaccinated at the earliest, okay? What is the time period to go for the side effect post-vaccine? Usually 24 to 48 hours. Some people have it for about 72 hours. But if it is lasting for more than that, do talk to a doctor, right? Usually 24 to 48 hours is what you get, right? There's somebody who asked about severe gastritis or acidity kind of problem 3 weeks post-COVID, right? Can happen. See, the second wave is very interesting, right? Let me talk a little bit about it before we go ahead and look at the rest of the questions. Of course, there are a lot of questions, but let me talk about the second wave. There's some interesting facts about the second wave of COVID-19 that we are seeing, right? A lot of people are getting gastrointestinal symptoms. So acidity, stomach pain, loose motions, nausea, feeling gaseous, these kind of symptoms people are getting. A lot of children are getting affected, all right, in this, in the last year when I was when I was consulting patients with COVID, it was majorly adults, but now I'm seeing a lot of children also getting affected. And though they will have mild symptoms, they won't have very serious symptoms, but then they are getting infected, right? So that is a second thing which is very interesting to note from last year to this year, right? The third thing that I'm also seeing is a lot of patients have symptoms, but they are RT-PCR, the RT-PCR test, right? Which is the the swab test that is taken from the nose and the throat. Now, a lot of people are initially RT-PCR negative, which is very interesting, right? They're initially RT-PCR negative, they're symptomatic. And when we repeat the test later, they are then getting positive report of RT-PCR. So if you have symptoms, if you're RT-PCR negative, doesn't mean that you don't have COVID. Please understand this. If you have symptoms, take it as if it is COVID unless otherwise proved, okay? So please get yourself talking to a doctor quickly and get yourself started on treatment, okay? So it's very interesting that these things are happening. It is this, the second wave also we've seen that there's been a boom. The increase in the number of patients who have suffered from COVID is very high. So it's very infectious. It's spreading like wildfire. One gets it, then, there are like 100 who get it quickly, and the amount of time required for spread is also, if you've been in a contact with a COVID positive patient for like 10-15 minutes, and the chance that you get it is very, very high. Okay. So that is also very interesting that we have seen. So it's extremely infectious, the second wave that we are seeing. And though it's very interesting to know that most patients who are getting infected, they have very mild to moderate symptoms, right? The serious symptoms are lesser, so it's more mild to moderate. So maybe the power of the virus maybe is a little lesser, or the virulence, as we say, is maybe a little lesser, but the number of people who are getting infected is extremely high. That itself causes a burden on the healthcare system and to all of us, right? So understand that a lot of people can have gastrointestinal symptoms. Please drink lots of water, keep your food very simple, non-spicy, non-oily food, and most probably it should get better. If your acidity, gastritis is too much, maybe you might need some medications. So talk to a doctor and maybe get an antacid or some kind of drug that is appropriate for your condition. All right. Do we get the same symptoms after the second dose of vaccine? A lot of people show much more, higher immunity. So a lot of people will not get any symptoms after the first dose, but after the second dose, they would have much more fever, or cough, cold is quite common because that's when the immune response is happening. So yes, it is possible for you to get symptoms after the second dose as well. Does ivermectin help in asymptomatic, mild symptomatic patients? Ivermectin is actually an anti-parasitic drug, right? It works against parasites or worm infestations, as we say. But it is also known to have a property called as immune modulation. It's an immune modulator, and that is the reason that it is being prescribed by a lot of doctors to help you tide over the infection. So yes, if your doctor is prescribing it to you, it is for a good reason. Please follow your prescription. All right. There are, can pregnant ladies get vaccinated? As of now, no. We know this, we have discussed this. Is COVID Shield a good vaccine? Yes, it is. Please go ahead and take it. What about the new foreign vaccines? Yes, good that you brought up. One is the Sputnik. The other one is that we are going to get is the Johnson & Johnson is trying to find approvals for testing their single dose vaccine. And if you see, from an efficacy perspective, right, we have the Pfizer and the Moderna, which is there in the US, then the Sputnik, then the Sinovac, the Oxford AstraZeneca, our indigenous Covaxin. So there's so many of them, right? So if you see the efficacy, and if you read literature, it'll be right from say 95% to as low as say 60% or so, right? So, but understand that all of these drugs help. They help to reduce the mortality and morbidity associated with the COVID-19 infection. So please, every from efficacy perspective, one might be a little higher or lower, but understand that all of them do the more or less the same work. All right. So do not worry about which vaccine you're taking. If you're getting a vaccine, just get yourself vaccinated, right? So I think that's very, very important. All right, so I'm going to just take a couple more questions. My family member was suffering from COVID right now. I'm so sorry. And they're on medication on the 5th day, they're having vomiting sensation. See, a lot of times when we are on multiple drugs, there can be some acidity and vomiting sensation. So talk to your treating doctor. They may give you some symptomatic relief for the nausea and the vomiting sensation, and hopefully it gets better. Keep food very light and keep yourself hydrated. This shall pass, okay? Take care and keep your spirits up. All right. There has been a question. I was found COVID positive 15 days back, and now I'm feeling well. Can I get vaccinated? Again, wait for 2 weeks. Wait for 2 weeks before you get vaccinated, right? A lot of people who are talking about they're afraid to get vaccinated because they have chronic diseases. Please get yourself vaccinated. Because you're having chronic diseases, you are at a higher risk of getting the infection. So please get yourself vaccinated. Okay. Let me just read through a couple of questions. We're kind of running out of time as well. So there's a question about, is it sufficient to know COVID vaccine infection through blood tests or markers after COVID treatment is completed, right? So if your treatment is completed and you are asymptomatic after 14 days, right, then I think it's all right. Then there's nothing more to be done. However, if you want to check any of their levels, you could repeat your RT-PCR, but it's not really required for you to do any markers after you're asymptomatic. If you want to know your antibody titers, then maybe you can get the test done, but that also is not very significant in terms of doing a test itself, right? So it's more to do with your symptomatology. That is more important for us to keep an eye on. All right. So just scrolling down, just a moment. And I know, I'm sorry if I've missed out any of your questions. I will try and come back and maybe we can do another session on this because I know this is a very, very important topic, and we are all, we're all worried, with the way the pandemic is going, right? When can we expect the COVID to go away forever? That is something, it's a question which none of us can answer at this point in time, isn't it? I wish it was not there with us, but the fact remains that it is around and it is causing, serious issues, health related issues for a lot of us. So unless we break this chain, right? How do we break the chain of transmission of illness? One is by the way we follow our COVID appropriate behavior, and two is by getting ourselves vaccinated. Unless we do that at like a individual, community, national, international level, right? Everybody follows it at all times. It's only then we can break the chain of transmission, and only then is when we can expect COVID to go away. All right. So let us not take this lightly, and let us ensure that we are protecting not ourselves but people around us as well. Okay. So very, very important, and it's a pertinent question. It is kind of affecting us at a very mental level as well. A lot of us are feeling extremely drained because this is just going on and on and on. But we have to be together in this, right? We have to take care of ourselves. We have to take care of the people around us. And hence it's important that we take vaccines, we follow the right protocols and take care of ourselves. All right. So I hope that helps. Okay. So there's a question about post-COVID, how long our antibodies stay? Can we get reinfected? Yes, there have been studies as well as patients who have gotten reinfected. I have, in my anecdotal experience, seen patients who get reinfected even after 3 to 4 months of their first infection. So the caveat is the same, right? Please follow appropriate use of masks and physical distancing, and stay away from crowded areas. There are no two ways about it. Okay. So antibodies do stay with us, but we do not know how long, and people are getting reinfected. So ensure that you follow all possible precautionary measures at all times. All right. My age is 36. When the government officials open the window of getting, when will the government officials? Well, we are all waiting for it, right? Currently, it is still 45. but we are hoping that they will quickly open it up for about 18, and when they do, then the most productive workforce will be also getting vaccinated very soon, right? So we are hoping that that happens very, very soon, and we'll try to, when as and when it happens, of course, it will be available to all of us. Okay. So there's a question about, do we get the same symptoms post-vaccination after the second dose as well? Yes, as I think we spoke about this, right? This can happen after second dose also. Symptoms can happen again, similar form, but it can be more intense in the second, after the second dose, because there is higher immune response that is happening, right? So yes, there's always a possibility of that. Okay. So okay, so I think we have taken so many questions, and I've tried to do justice to answering all of them. But of course, if you have more questions, do put it up, and I'll try and answer all of them to the best of my abilities. But just to summarize, what we have said, right? Vaccination. There are two things which are way forward, right? If we want to fight and win over COVID-19 infection, one is ensuring that vaccinations happen, okay, and we all get vaccinated. Two is that we continue to follow COVID appropriate behavior in terms of wearing masks, sanitization, physical distancing, staying away from crowded area, and not ignoring our symptoms and reaching out to doctor as and when required. Okay, so unless we do these things, right, everybody does it, right? There is no way that that this is the only way that we can win over COVID-19, and we have to be together in this, right? It is not that only few people are following it. Everybody should follow it, right? Remember, whichever vaccine you're getting, be it Covishield or Covaxin, the efficacy is similar, and they are going to only help us in reducing our intensity of illness if we get it, reducing our hospital stays. They will reduce our mortality rates. They will, the side effect profile is much lower than the benefits that they can provide, because if we don't take the vaccine, then we will get COVID-19 infection at some point in time, and that can be difficult. All right. When we take the vaccine, we are going to help ourselves, and we're going to help people around us as well. We're going to protect everyone. So it's a good thing to get ourselves vaccinated. With the newer vaccines coming in, I think the availability will be much better, and that will also help us to increase the reach of the vaccine that is currently that is available currently. So that will also help, right? So do not fall for misinformation, and do not fall for fake news. If you want to get any clarification, reach out to your doctor, talk to your doctor, because that's the right thing to do. All right, so please take care of yourself, stay safe, stay healthy, and take care. Let us all work together to fight against COVID-19. All right, so until next time, take care and goodbye.